Texas, May 2001. Robert Ernst is 59 years old, a marathon runner who manages the produce aisle at a Walmart. He goes to sleep next to his wife, Carol. He does not wake up. For 8 months, Robert had been swallowing a small pill for the pain in his hands. The pill is called Vioxx. The bottle says it is safer. Robert Ernst is not a statistic. He is one face. A federal scientist will later estimate there are tens of thousands of them. Dr. Graham of the FDA testifies to the U.S. Senate that Vioxx caused between 88,000 and 139,000 heart attacks and strokes in America. Of those, he says, 30 to 40% probably died. He calls it the single greatest drug safety catastrophe in the history of this country, or the history of the world. And here is the part that turns a tragedy into a crime. The company already knew. The warning was sitting in their own data 4 years before Robert Ernst closed his eyes. This is the story of how Merck buried a heart attack signal to protect a blockbuster, and how a marathon runner paid the bill. Vioxx is approved in May 1999. It is a new kind of painkiller, marketed as gentler on the stomach than the old pills. It becomes a blockbuster. More than 80 million people take it. Then, in 2000, Merck runs a study called Vigor. It is supposed to prove Vioxx is easy on the stomach. It does, but it also shows something else. Patients on Vioxx have roughly 5 times as many heart attacks as patients on an older, cheaper drug. So Merck explains it away. The other drug, they argue, must be magically protecting hearts, not Vioxx hurting them. There is no real proof for this theory. They run with it anyway. It gets worse. When the Vigor results are published in the New England Journal of Medicine, 3 heart attacks in the Vioxx group are missing. The journal later finds the data was deleted from the manuscript 2 days before it was submitted. Inside Merck, the machine keeps turning. Sales reps are trained with a card game called Dodgeball. Practice in dodging doctors' questions about Vioxx and the heart. A leaked email lists 36 physicians to neutralize, next to other doctors who keep asking questions. Discredit. On September 30th, 2004, after a new trial finally proves Vioxx doubles the risk of heart attack and stroke, Merck pulls it from shelves worldwide. 5 years too late. Tens of thousands of hearts too late. In August 2005, a Texas jury hears Carol Ernst's case and rules against Merck, awarding her about $253 million. In 2007, Merck agrees to pay $4.85 billion to settle more than 27,000 lawsuits. In 2011, it pleads guilty and pays the federal government another $950 million. The money is real. So was the warning. So was Robert Ernst asleep, trusting a label that the people who printed it already doubted. When a number in a study is more inconvenient than a human life, somebody chose the number. Recall files, we recall what others forget. Subscribe, hold them accountable,